Hello and welcome to this presentation on the biggest challenges facing AI deployment in healthcare. My name is Dr. Annabelle Painter and I'm the Chief Medical Officer at Visiba. So if we think about the challenge of AI in healthcare, the first question to ask is, what are we trying to achieve with AI in healthcare? And to me, the best way of thinking about this is looking at the quintuple aim. So in 2007, the Institute of Healthcare Improvement released the triple aim, which has now developed into the quintuple aim about healthcare improvement. And to me, this really signifies the key areas that we're trying to improve with AI in healthcare. So it's about improving patient experience, about improving population health outcomes, reducing costs in healthcare, about care team well-being, and about health equity. So what are the challenges that are ahead that might prevent this from being actualized through AI deployment in healthcare? Well, when I think about this, I think we can think about them in 5 main groups. The first is the rules. We need to make sure that we have the right rules in place to allow AI to be deployed effectively. Second, we need to make sure we have the basic infrastructure that we need to allow AI to succeed in healthcare. Thirdly, we need to make sure we can evaluate AI properly. Fourthly, we need to make sure we have the people we need within healthcare. And lastly, we need to answer the question of how do we unlock the productivity potential from AI. So let's get into each of these in more detail. So first of all, the rules. So when I'm talking about rules, I really mean about the guidelines and the legislature we have in place about AI. So if we think about law first, let's talk about regulation. The regulatory challenge when it comes to AI is producing regulation that ensures that AI deployed in healthcare is safe and is effective, but also permits AI innovation in healthcare and doesn't prevent useful technologies from reaching healthcare professionals. Now, in recent years, there's been quite a lot of regulatory development in the EU. So we saw MDR come into effect in 2021, and that wasn't without its challenges. And many of you will be familiar with the long waits that there have been for notified body assessments. And more recently, we've seen the introduction of the EU AI Act. So we now have the horizontal EU AI Act come into place across different sectors. And we have that linked to the vertical regulation that we have in terms of medical device regulation. And the concern is that there may be significant overlap and clashes between these 2 bits of regulation. And several concerns have been raised about this. So for example, when it comes to the evaluation of AI technologies within the European Union, the EU AI Act states that you need a CE mark before you can use a high-risk AI technology on people. But the EU MDR states that before you can get a CE mark, you need to do a clinical evaluation on people. So it seems there may be areas where these 2 bits of regulation conflict, and there's going to be a challenge going forward to make sure that we can align these 2 bits of regulation to make sure that we can still have effective AI use in healthcare within the EU. And that's really an EU-centric view on things. But of course, we have different regulatory structures in different parts of the world. And that in itself is problematic because it makes alignment with these different regulatory processes challenging for innovators and very expensive and time-consuming. So there is calls for more international harmonization between regulatory frameworks. And hopefully we will see that in the coming years. So the next bit of law I want to talk about is liability. So the challenge here is working out who should be held accountable for AI decisions within healthcare. Should the liability fall on the clinician who's making a clinical decision using an AI tool? Should it fall on the developers of those AI tools? Should it fall on the healthcare institution that's chosen to deploy that AI tool? And how do we get the balance right amongst all these parties? Is it fair that a clinician should always be held accountable for a clinical decision when they're using an AI tool that convincingly tells them that an output should be used and that may not be the area of that clinician's expertise? Equally, should clinicians be held to account for not using an AI output in their clinical decision-making that would have led to a better clinical outcome should they have used it? And all of these questions remain grey areas, and there's a lot of uncertainty in this field of liability. And clarity is needed to make sure that everyone is confident in how AI can and should be used in healthcare. And that's just talking about clinically assistive AI tools. What happens when we have autonomous healthcare AI tools where there is no clinician in this loop? There's no clinician liability in the loop. Who's held accountable then, and what frameworks can we use? Now, this kind of problem isn't specific to healthcare. In fact, the same kind of questions are relevant to, for example, self-driving cars. And so it's interesting to see how liability is being worked out across sectors and how that might apply to healthcare. The final set of rules that are important to discuss here is about procurement. So challenges that a lot of AI developers face when trying to sell into healthcare is that the AI that they develop allows for a whole new way of working within healthcare, and it's disruptive to the current system. And the value it provides is different to the value that we currently get from the existing healthcare structures. And that has huge potential for improving healthcare. However, the way that technology and resources are procured in healthcare aligns with the existing structure. And so it can be very hard to work out who will pay for these innovative technologies when the procurement structures don't align. So we need to think carefully about how we procure AI technologies within healthcare. We need to make sure we have the right kind of protective budgets for technology, and also to think innovatively about where value is added in healthcare and how to reimburse that value for new disruptive technologies. Ultimately, we want to make sure that our healthcare systems are intelligent customers for AI, that they deploy AI that's going to add the most value to healthcare, and that they do it in a strategic and in an effective way. Okay, so the next big challenge to talk about is the infrastructure challenge. So we need to make sure that we have the technical infrastructure and the data infrastructure in place that will allow AI to succeed in healthcare. And there's many facets to this. One of the most basic is making sure that our healthcare system is digitized. There is still, unfortunately, quite a long way to go in healthcare for making it fully digitized, although there has been a lot of progress in the last few decades. But personally, I'm very used to still using pagers and using fax machines at work. And this simply doesn't align with the kind of data infrastructure that we need for a successful AI deployment in healthcare. Once we get there, we need to make sure that the data infrastructure that's attached to our digitalized healthcare system is effective. So we need to make sure that we're creating data, that we're curating that data, and they're communicating that data effectively. Healthcare data has a lot of problems that need to be fixed, and the quality is really below the standard that we need for effective AI development and deployment and evaluation. And you can think about these data problems as V's. So there's problems of volume, of variety, of velocity, of validity, and of veracity of healthcare data. And we want to try and tackle all of these to make sure that we have a data infrastructure that is usable and that is trusted as being high quality. And then we can really unleash the true value of AI in healthcare. So the next step is about standardization. So in relation to data, standardization is very powerful. By standardizing things like data formats, coding languages, terminology, and transport standards, we can allow for much more effective communication of data across healthcare. But standardization is not just about data. It's also about ways of working in healthcare. And for example, the ways that different technologies are evaluated, or the way that certain images are captured in healthcare. If we can standardize those ways of working, then deploying AI at scale becomes much more feasible. The next step is about interoperability. So we need to make sure that healthcare software is interoperable, and this should be a requirement for healthcare software in future. And alongside that, we need to make sure that integration is possible, and things like widespread API use, etc., will be helpful here. Okay, so the next challenge to talk about is evaluation. And I think what we often see with AI innovators in healthcare is they get stuck in somewhat of an evidence paradox. So innovators of AI technology need to generate evidence. They need to generate evidence to convince people that their product is safe and effective and that they have appropriately cost effectiveness. However, healthcare systems already want evidence before they deploy these technologies. So the innovators need access to the healthcare system in order to generate the evidence they need, but the healthcare system wants evidence before they'll deploy these technologies. And you can see that there's this evidence paradox where innovators get stuck in this loop. So what can we do to break this paradox? Well, I think an important step is linking reimbursement with evidence, because this incentivizes evidence generation. But in order to do this, we need to allow developers and innovators to be implemented in healthcare and then have time to generate their evidence. So what we've seen in France and in Germany is that they have two pathways. Now, this is specifically for digital therapeutics, mostly, but what they allow is for those technologies to be deployed, and then they have a period of time where they have preliminary registration, where they have time to generate evidence. And I think these kind of pathways that also link reimbursement with evidence can be very powerful. And I think we may see more of these being developed across different countries, and hopefully also in relation to AI technologies where the same principles apply. So on the topic of evaluation, another important consideration is ongoing monitoring. So not only do we need to evaluate AI technologies before they're deployed in healthcare, but continually within healthcare once deployed. And this is something that distinguishes AI technologies from a lot of other digital technologies. And that's because the performance of AI models can degrade over time due to things like shifts in data and shifts in the populations using the tool, or perhaps changes in, for example, the scanners that might be inputting scans into tools and things like that. So this kind of ongoing monitoring methodology is really important, but it's not well established in healthcare exactly what this will look like or who will be responsible for it. So there's some key questions about where this ongoing monitoring should take place. Should it be at a local level, or should it be at a national level, and how will it be coordinated? Then we need to think about how frequently this ongoing monitoring needs to take place. We also need to think about who is responsible for doing the ongoing monitoring. Is it the innovators and developers of AI? Is it those deploying the AI? Is it them working together in collaboration? Next, we need to think about logistically, how do we make this happen? Because realistically, we probably are going to need the innovators, developers of these AI technologies to be taking part in this ongoing monitoring process. But in order to do that, they need ongoing access to health data. And so there needs to be new kind of data sharing agreements that allow for that ongoing data sharing relationship. And finally, we need to think about what are we monitoring when it comes to these tools. We might want to check their performance continues as is expected in healthcare, but should we also be monitoring for things like bias, for how these tools affect certain groups within the population, and who sets what we should be looking at? So the next big challenge to think about relates to people. So when it comes to digital transformation, you can certainly argue that technology is actually the easy part. What's hard is the people change. And part of this is about change management and making sure we have buy-in from people within healthcare and driving behavior change. But it's also about making sure that we have the right skills and capabilities within our healthcare workforce. Because we are going to need a healthcare workforce that can use AI effectively. And that includes being able to communicate about AI with patients, to explain the risks and the benefits, and to counsel patients about when it may or may not be appropriate to use AI for their care. We need people who can create AI. And I think this is quite important because often AI technologies in healthcare to date, we have seen coming from third-party AI developers who've then sold into healthcare. And that can have great impact, and there's huge potential for that in healthcare. But ultimately, the only kind of problems that are going to be solved by that kind of organization are ones that make a good business model. So they need to be scalable. So for example, solving a problem that happens at a national scale, like screening, makes a lot of sense for a commercial organization to pursue. But there are a lot of problems in healthcare that don't make good business cases. So if it's a disease that affects a very small number of people, or it's about improving some metric on a scan that it's hard to make a business case for, there could still be huge potential for clinical value for those tools. But companies aren't going to be making these kind of AI tools. So instead, the kind of AI tools that I'm talking about might need to be made in-house within healthcare systems. But in order for that to happen, we need to make sure we have the right skills and capabilities within healthcare systems to make AI. And at the moment, that simply isn't the case in general. We also need people who can procure AI. And I think what this means is about having people who have the ability to ask the right questions of AI, companies and of products, to make sure that it's delivering the kind of value that they want, to be able to critically appraise potential AI technologies, and to be able to make sure that the way that they procure AI is strategic and delivers the best value for the healthcare system. We need people within healthcare who can implement AI, who can technically integrate AI technologies into the healthcare system, but who also know how to introduce AI into workflows, where it's appropriate to introduce AI into the clinical decision-making process, and how the clinical workflows and ways of working might need to change to adapt appropriately to AI. And that involves lots of skills, both technical, but also more soft skills to do with change management. We need people who can evaluate AI, people who know how to critically appraise AI technologies, how to conduct studies evaluating AI, and how to do that ongoing monitoring step that we were just talking about. And as I mentioned before, we need people who have the ability to explain AI, both across the healthcare workforce to their colleagues, but also to patients and users. So what do we need in the workforce in order to achieve this? Well, first of all, we need education. We need to introduce the knowledge and skills relating to AI across the workforce. And this is at all levels in the workforce, from clinical to non-clinical, from leadership to all members of staff. Next, we're going to need to introduce new roles. So we're going to need AI and data specialists within the healthcare system. And we're going to need new AI leadership roles for people to move into, both technical expertise within leadership, but also having clinician AI specialists. And we're going to need new career paths for people to follow. So this will include, again, both technical specialists, but also people who have new joint clinical and AI technical career paths. And we're going to need new ways of working. We're going to need new multidisciplinary AI teams, and we're going to need to have the potential to collaborate across sites at a national level. The final challenge I want to talk about is something called the productivity paradox. And this is the tendency to fit new technology into the existing system when the true value is only realized when the system is fundamentally reshaped. Now, this paradox you see when any new fundamental technology is introduced. So for example, historically, when we've seen the introduction of electricity or the introduction of computers, these new technologies never deliver their productivity potential initially. Just by introducing them into existing workflows and into the existing structure does not allow for their value to be unlocked. Instead, you need to completely rethink how we work in order to make use of these technologies. So if we think now about how computers have become so prevalent within healthcare and it's become a central part of how we do our work, but initially when a computer was first put into into the healthcare system as it was with its traditional ways of working, it didn't unlock productivity, and actually initially often productivity decreases as we try and work out how these technologies fit into our existing system. So in order to make the best value of AI, we need to take a step back and really rethink how we deliver our care in healthcare. We need to think about how we can reshape ways of working so that we can work around AI and make best use of those tools and unlock their true value. This is something that's really, really hard to achieve, but doing so will be hugely important within healthcare. So to summarize, the first challenge we need to overcome is the rules. We need to get regulation right. We need to make sure we're clear on accountability, and we need to make sure we have the right structures for procuring AI in an effective way. The second challenge is about infrastructure. This is about data creation, curation, and communication. It's about making sure we have all of the technical infrastructure that we need in order to deliver AI at scale. The third challenge is about evaluation. How can we overcome that evidence paradox? How can we ensure that the AI that's being deployed in healthcare is safe and effective, but think about novel ways of evaluating it that keep pace with ever-changing technological advances? The fourth challenge is people. First of all, how can we help to win people over to AI? But secondly, how can we make sure we have the skills, the education, the teams, the roles, and the expertise within healthcare, and make sure that we have the right structure and organization that allows these people to prosper within healthcare? And the final challenge is about productivity. If we want to overcome the productivity paradox, we need to take a step back and think about changing the nature of work itself within healthcare to unlock the value of AI. Thank you for listening.